Good morning to all the dear colleagues, to all the dear participants that are joining this webinar today and that are joining for the 5th time under the Health Systems for Early Childhood Development Initiative, jointly led by UNICEF, Office for Europe and Central Asia, WHO, Regional Office for Europe, and the International Step-by-Step Association. Before we start, and as our colleagues are joining and the number of participants growing slowly, I want to introduce some technical information. As usual, we have translations to multiple languages. Today, we have it available in Serbian, but also hoping that colleagues speaking Bosnian, Croatian, Montenegrin will be able to follow and understand Russian and Bulgarian. And please go to the little interpretation globe at the bottom and choose the language of your choice. We will also have the possibility today, as always, to write your questions and to ask us, and you can use Q&A or chat. We will try to monitor both and to provide responses as soon as possible. And without further ado, we can go through the quickly to see the program that is quite rich today, as we have an exciting opportunity to hear more about the Nurturing Care Practice Guide from our headquarter colleagues from World Health Organization and UNICEF. We will have experts from our region, practitioners, managers, trainers, to reflect on what they do and how will Practice Guide help them. We'll respond to Q&As, present some additional materials, and of course, finish with the closing remarks. I'm also very glad that today we have Dr. Mihaela Ionescu, Program Director at the Step-by-Step Association with us, and I kindly invite her to open the webinar. Over to you, Mihaela.
Thank you so much, Alex. Greetings to everyone, and a very warm welcome on behalf of UNICEF Regional Office for Europe and Central Asia, WHO Regional Office for Europe, and ESA, to this webinar hosted under the Health System for ECD initiative. It's such a privilege to open the regional launching event of the Nurturing Care Practice Guide. And I would add, what better place to host such an event than the Health Systems for Early Childhood Development Initiative, the initiative that strives to enhance the impact of health systems and their services on child's overall development. The past 5 years, since 2018, when the Nurturing Care framework was launched, have been a very rich journey of persistent work towards equipping the framework with the right tool to translate such a framework into action and to increase its relevance for the numerous actors working primarily in the health sector. But I would dare say not only. The framework is highly relevant for all those who are making decisions for and working in the early childhood field. For us in ESA, for example, it has been a true inspiration in shaping our advocacy work through the first year's first priority early childhood development focus campaign, and in the comprehensive approach we are bringing in the work with municipalities in countries from our regions, but also in our initiatives focusing on parenting and home visiting. The Nurturing Care Handbook and the Practice Guide are aiming to equip policymakers and program managers, primarily in the health system, with the mindset, the steps, and the tools to create a connective tissue among different policies, services, and programs that can convergently work towards creating an ecosystem that prioritizes the child's healthy development by not neglecting any of the 5 areas in the framework, which are fundamental for fulfilling the conditions for children to receive the optimal care that they are entitled to in their first years of life. While targeting primarily policymakers and service providers in the health system, the Practice Guide is an excellent example of a practical and strategical tool, not only to inspire action, but to create leadership in promoting a comprehensive approach to child's development, thus lending a hand to other sectors and making an important step towards connecting and even more integrating programs and services to enhance their collective impact on child's optimal development while caring for the caregivers. We hope that the webinar today will bring the nurturing care framework, the handbook, and specifically the practice guide closer to stakeholders in Europe and Central Asia, and will inspire advocacy efforts, policymaking, and service and program development and management towards a more solid understanding of how much more can be done to ensure a child's healthy development, no matter where the child is born, if children stay at the core of our decisions and actions. We are excited to have you with us today and together with all our guests to provide you with an overview of the practice guide and with a deeper insight into how it can be used by managers, trainers, or practitioners working in health and nutrition services so that stronger foundations for healthy development are laid from the very first days of life of a child. Huge thanks to our guests for accepting the invitation to participate in the event, and to all of you who chose to spend the next hour and a half to learn more about the Nurturing Care Practice Guide. Thank you, Alex.
Thank you, Michaela, for so thoughtful remarks. I think that you are making the next part and the job of our dear colleagues from WHO and UNICEF easier, because you have shared, so many wonderful sites that the practice guides will bring us. The Nurturing Care Practice Guide and the handbook were launched last week in New York, and we are very grateful and proud to be the first region to follow up with the regional launch. And without further ado, I have the pleasure to introduce my distinguished colleagues, Dr. Anne Detienne, who is the Child Health Specialist at the Child and Community Health Unit at UNICEF New York. Welcome, Anne. And Sheila Manji, who is the ECD Specialist at the Child Health and Development Unit at the World Health Organization in Geneva. Welcome, Sheila, as well. And Anne, the floor is yours. We are looking forward to hear from you.
Thank you, Alex. I'm actually going to steal the floor away from Anne for the first part. So thank you, Alex, and thank you, Mihaela, very much for the warm remarks there. And as you said, Alex, I think you set the stage really, really nicely here for the conversation today. So on behalf of Anne and myself, we really want to give a big thank you to the UNICEF and WHO regional offices, as well as to ISA for taking the initiative to say, we want to learn more, and we want everybody in our region to learn more, and we want to see and explore together how we might use the practice guide in our context. So it's been a really good exercise for Anne and I to go through it in a bit more depth, having been on this journey for the last couple of years at least. And so we wanted to share with you a little bit of the background story of what has led to the development of the practice guide. So why have we done this? So I will speak about that. Then Anne will take you through the different sections of the practice guide, explain what you will find in there. And then I will take you on the website, show you a little bit of how you can find what you need there. And then we'll close with a little bit of inspiration, hopefully some suggestions of what you might do with the practice guide going forward. So if it allows me, I will share there we go. So to start with, you'll recall that in the Nurturing Care Framework, we have these two figures, and these are our central guideposts for everything we think about when we talk about nurturing care. The one on the left are the components of nurturing care, which everybody is familiar with, and we stress over and over again that every child needs all 5 components, and every child needs caregivers who are able to provide those 5 components of nurturing care. And so that links to the figure on the right side of the screen, the enabling environment. If we want our caregivers to be able to have the capabilities, the time, the knowledge, the skills, the confidence, the resources to provide nurturing care for their children, they need support as well. And that comes through the empowered communities, the supportive services, and enabling policies. So these two are always in the back of our minds when we're thinking about how do we implement the Nurturing Care Framework. Shortly after the framework was launched in 2018, we started saying, okay, what can we do to support different stakeholders, different sectors with implementing the framework? The Nurturing Care Framework has 5 strategic actions. And so we're always thinking about, okay, what can be done at the policy level, but what can also be done at the service level? What can be done to support more research and help us make better decisions? So there are two resources that kind of take this concept a little bit further. One that was released in 2019, which is the Operationalizing Nurturing Care for ACD. And that one's focused on the role of the health sector alongside other sectors and actors. And so this was a quick reflection of what could the health sector with other sectors do to bring to reality the different strategic actions that are in the nurturing care framework. And then, as you heard, recently, in the last week, we launched the Nurturing Care Handbook, which takes each of these 5 strategic actions and goes into more depth. They break down into 3 thematic areas in each guide, and they provide suggestions of what you might want to think about. So what are some of the questions that come up? What are some of the actions that you might take? And then what are some signs of progress that you might want to be looking for around each of these strategic actions? There is one guide for each of the strategic actions, and then there is a 6th one, which is actually the first one in the set, called Start Here. And that one, we recommend that you start there for obvious reasons, because it will give you a better sense of how the guide or the handbook is organized and where you can find the different things you're looking for. You don't need to use all of them. You can start with the Start Here, and then you can jump to wherever you want to go to next. Now, the thing is that these ones focus on the big picture, that ecosystem that Mihaela was talking about. What do we need to do to create the enabling environments for nurturing care? But what about closer to the families? What can we be doing to support families where they're at? So a consistent message that you see in the nurturing care framework and in all the materials that come afterwards is, if we're talking about the youngest child, so from children under 3, where are they typically? What services are they typically using? It's usually the health and nutrition services. And so that presents an opportunity for us to support the caregivers, to help them learn skills, get access to resources, think about things they may not be aware of, or get answers to questions they may be thinking about that can help them provide nurturing care for their children. So these are just some examples of the services that are already available, where we are already in contact with caregivers, and we might want to think about how we use them more creatively or differently than we do now. We know that if we think about the 5 components of nurturing care, we know that we are already supporting 2 areas. Systematically, we are supporting the areas of health and nutrition when it comes to health and nutrition services. But what about the other 3 components? How can health and nutrition services better support caregivers with the other 3 components of nurturing care? What can happen there? And then, as Mihaela spoke about, we have to remember the caregivers. If we want children to receive nurturing care, we cannot leave the caregiver out of the equation. So how could health and nutrition services support caregiver well-being? So we want to make sure that we're continuing to strengthen and do the work we've already been doing in health and nutrition services. But the question that kept coming up over and over again is saying, okay, if you're telling us that health and nutrition services are the platform that we should be using, what should we be doing? And how can we do it? And so that's where this practice guide came in. We have a number of tools that already exist globally in the region, different adaptations that touch on this issue in different ways. They might look at one component or another component. They don't necessarily look at all of the components together. These, the ones on the screen here, are training packages. Where people often struggled then was to say, well, how do I apply these concepts in my routine services? So if I take the concept of responsive caregiving, you've trained me on responsive caregiving, I understand what it is, I understand why it's important, but how can I do that during an antenatal care visit? Right? What would that look like? And so that's what the practice guide seeks to do. It seeks to give you concrete suggestions of what you can do by service. It is not a training package. We hope that you see it as a complement to the training packages that already exist, that you use it as a way to reinforce the trainings that have already happened, or as a way to perhaps orient people ahead of a training, or give a tool, a practical tool that people can leave with that they can use in their practice. So I'm going to hand over to Anne, who's now going to take us through the actual content of the practice guide.
Yeah, so I'm your tour guide. You're going to get a little round through the content of the guide, which targets both providers as well as managers of health and nutrition services. As Sheila said, it focuses on 3 of the 5 components of nurturing care, as well as on caregiver well-being. And it includes considerations to serve all children and their caregivers, including children with chronic illness, developmental delays, or those living with disabilities. It's relevant also and touches on modifications that might have to be made in humanitarian and emergency settings. Next slide, Sheila. So as Sheila said already, everybody, all caregivers and children require some support, and we call that universal support. And that's really what the practice guide focuses on these universal messages, support to caregivers that providers of health and nutrition services can give. We know that there are children and families that need more targeted support. So they would benefit, for example, from additional contacts with providers, from an extra home visit, to make sure that they have the support that they needed. And then there are those, but it's the minority of families that need really more specialized services. We call that indicated support. We provide in an annex some thoughts and some guidance on how the support by providers might look like for this targeted and indicated support, but we don't go into details. We focus on the universal support. Next slide. The practice guide has 3 sections. Part 1 really gives the rationale for strengthening support for those 4 components in health and nutrition services. The second part talks about the role of managers. What do you need to do to enable and prepare your services to also provide the environment for providers to give their support to caregivers? And then the third part really gives some very practical examples for different services at different life course stages on what the kind of support is that providers can give to caregivers and children. So I'm going to run through each of these 3 parts. First, the nurturing care, another look, and maybe just give the next slide, Sheila. So here we really want to make sure that everybody understands what we mean with these 4 components and what the rationale, what the concept is of them. So responsive caregiving really refers to the ability of the caregivers to understand and respond in a timely manner to their child's signals. We see this as the foundational component of nurturing care because it's really important that caregivers understand what responsiveness is, that they can be responsive. Only then will they be able to really optimally support the other 4 components. Next slide. Early learning refers to an opportunity for the infant or the child to interact, not only with people, but with places or objects in their environments. And it recognizes that every interaction or an absence of an interaction is contributing to the child's brain development. So it's important that caregivers understand how they can identify and leverage those opportunities to support their children's early learning and playing. Next slide. Safety and security refers to the environments that children and their families live in. And we mean by that, with the environment, both physical dangers, emotional stress, environmental risks, but also safe access to food and water. Next slide. And the caregiver well-being, as Sheila said, is something that we actually added in the practice guide. It's not part of the pedal that you know for nurturing care. And it refers to the caregiver's physical and mental health. Only a caregiver that is able to care for themselves are able to support their children and be responsive to their children's needs and support their growth and development. Next slide. So what is it that providers can do? What's the role of us providing health and nutrition services in helping caregivers to achieve those skills? Providers, as Sheila said, have these regular interactions with caregivers and children, and they can observe how they interact with their children. They can ask questions and discuss any concerns or worries that caregivers might have. They can be models. They can introduce some of those concepts of responsiveness, of playing with a child, of taking cues, of responding to it. And they can help to encourage caregivers in what they do, and they can help to problem solve and find solutions to some of the support that caregivers might need. So they can support caregivers to be more responsive, to recognize opportunities, to provide a safe environment, and to be well. And this is part of the first section of the guide, where we really outline what are those skills that providers require to actually support caregivers in acquiring these skills. So providers need to be able to have interpersonal skills to really engage and interact with caregivers, to have appropriate communications, to listen, to observe. And then there are very specific skills to support these practices around responsive caregiving, early learning, and safety and security and caregiver well-being. Next slide. I'm now going into the second part on the role of managers and what do managers have to do to really create the right environment. And the first thing is that it starts with the facility itself. Facilities should be accessible and welcoming to all children and their families. So we have a little checklist in the guide that says, okay, is the facility actually accessible to everyone? So including people with disabilities, are there ramps for wheelchairs? Are there child-friendly corners and spaces? Is there play material for children? Is there information material accessible to caregivers in the waiting space where they are sitting and have time to maybe access some of those? Are there child-friendly toilets, hand washing stations? These kinds of simple modifications to a facility that will create an environment that is much more welcoming to caregivers and children. There are some considerations of what you might have to do in the humanitarian context. There are different priorities that you need to set. You might have to change on how you access families. How can you make sure you still access them and that you don't forget these other key components, that you not only focus on the provision of health services, but you even intensify the support to caregivers because you know that they might be under duress. And then it's also about managers to understand what are the needs of my community, what are the needs of my caregivers, what are the services that are accessible if I identify a family that needs more targeted or more indicated support. Where can I refer them? How can I advocate for making these services available closer to my facility so that it's easier for families to reach? Next slide. We then go into the role of managers and ensuring managers at different levels to ensure that providers actually have the skills to support caregivers. So this is what I started to touch on earlier. It is really, we need to build in pre-service training, but also in-service support and training to providers that they have those interpersonal communication skills, that they have the skills to support caregivers and strengthen caregiver practices. But that also means that we need to adapt the services to enable and capacitate the providers to spend that extra time with caregivers. So it might mean that we need to expand the time that a visit takes, because we want to create time for a conversation between the provider and the caregiver. We want to make sure that responsive caregiving, that the support to caregivers is really integrated in management protocols for providers, but that it's also included in supervisory checklists, that it's part of monitoring and support to providers of health and nutrition services. Next slide. And then the third part is really very practical, and it's targeted for the providers of different services. So Sheila, if you go to the next slide, there are different sections in the third part, and you can take each section separately and can pull it out and share it with the providers of those specific services. There's a section for antenatal care, there's a section for postnatal care, and then we divide between caring for a well child as well as caring for a sick child. And the next slide has just an example, one example of how that looks like. So for sick child services, we differentiate between outpatient care and inpatient care. And we recognize that when you have a sick child, the priority is to ensure and nurture that child back to health. And there's no time to focus on normal child development or on learning and playing, but it is important to focus that caregivers can be responsive and that they understand how their child is feeling. If it is in pain, if it needs more support, if you need to seek medical care, how do you nurture a child? How do you recognize what it needs in order to become healthy again? Even a sick child can learn and can play, but you might to adapt what you do with a sick child. A sick child needs good nutrition, right? How do you adapt your feeding of your child in the context of a sick child? So that's really the focus there. But also in terms of caregiver well-being, how do you make sure that the caregiver who cares for that sick child is actually enabled to do so? So there might be other children in the house. Just asking, do you have help, might enable and empower the caregiver to find some solution, to have the time and the support that it needs to take care of a sick child. And similar is the structure of all of the other sections in that third part. And I'm going to turn it back to Sheila now, who's giving you a little bit of an idea of how you can access the different parts of the guides and also what we have in the annexes. Back to you, Sheila.
Thanks, Anne. I'm going to get out of here and take us on the website so that you can see how the website is structured. So this is, and we'll make sure you have the link to the guide so that you can access it. But there are 3 different ways you can access the guide. You can download the entire document, which would have all 3 sections in it, as well as the annexes. You can download it by section. So if you really want to just have more of a deep dive into the different components and the rationales, here today we gave you just the high level, here are the definitions, but in the guide it goes into more detail of why is this area important and why should a healthcare provider be thinking about these components. Then, or if you're a manager and you say, I'm going to be working with managers, I want to think about what can I do to create a more enabling environment in my facilities. So you have the option to download by section. And then a third way, which is the last part that Anne was just presenting to us, are the individual services. So if you wanted to see an example of how a particular, or if you're working with a provider, you want to give them a suggestion of something that they could do, you could give, I'm working in antenatal care. I want to be able to have a better understanding of what I could do in my service. And so it starts with a bit of a background of, why is this an opportunity? And then here are the ideas of what you could do. There are different suggestions, different types of ideas in each of these handouts. We call them handouts, but obviously there's not an expectation that you would do each and every single one that is here. Right? Sometimes you'll look at it and you'll say, but there's too many. How would I ever find the time to do all of them in a particular service? And that's absolutely not the expectation. The idea here is to give you ideas of what you might do, what you might say, because we find the questions that often came up, and that's why we did the practice guide is, but what can I do? I know it's important, but what can I do? So this is really just to give you some ideas. There are 3 annexes. The first one summarizes different resources that are available that can help you explore the concept of nurturing care more deeply, as well as the different materials we've developed to support implementation of the framework. There is a second annex which focuses on those training packages. So it gives you a whole list of different types of training packages that exist. And then the third one goes back to the pyramids that Anne was presenting. So it's giving you some ideas of how you might be able to adapt this for targeted or indicated support. So obviously the idea here is to be flexible. You go where you need to go. You use what you need to use. You use it the way you think would work for your context. So as you think about this, obviously we would encourage you to look at as much of it as you can so you get a feel for it. We do think that those handouts in the third section or the tables that are in the document, that will probably be a good reference point for you, or if you're could be giving directly to service providers. But we recognize that you're not starting from scratch. Many of you are already offering services, have been looking at different ways to adapt your services. So look at this and say, well, what's one thing I could incorporate? What's something that I could adapt in what I'm already doing? How might this complement what I've already tried in my context? And then if you're doing trainings, how might this fit in? How might you be able to use like the table that Anne showed around the skills that we would like providers to have to support these areas? How could that be brought into a training that you're doing? If you're doing pre-service training, are there opportunities to think about these aspects in your pre-service training or with mentoring and supervision? And then because the guide has been presented in different ways, you might say, I'm just going to focus on one section, and maybe I'm going to look at the one for managers or look at the one for providers. So really, the door is open to say, this is a resource, and please use it the way that it makes sense for you, building on what you have already been doing. But we would love to learn how you use it. So please do document what you're doing. Please do share with us what you're doing. We'd love to get ideas and inspiration from you as well. We've given one half of the is it the coin or the journey? And we'd love to see you meet us on this journey as well and think through together what we can do and how the guide can help you on your next step. So I'll conclude here by giving a big thank you to the many, many, many people that were involved in developing this practice guide. But first and foremost, a huge thank you to Jane Lucas, who really did take the heavy lift on this and really helped us bring this to life. And of course, to our financial supporters of the King Baudouin Foundation of USA and to the United States Agency for International Development. We are here ready to support you, ready to answer questions, and ready to learn with you. So interested now to hear your ideas and what you'd like to do next. Thanks, and handing it back to you, Alex.
Thank you so much to both Anne and Sheila. I think that you have done a wonderful work in this presentation to really present how useful job aid it actually is, how practical it is, and how it can take us to the next level and ease the work in the daily engagement with the caretakers. In our region, many countries have started operationalizing nurturing care framework through the work of the health professionals. And we are very glad to see that the practice guide can really complement and strengthen their efforts in the future. We hope that you will put the questions for Anne and Sheila in the chat, and we will address them after the next part. We wanted, before going further, just to check with you. We note that there have been some translation issues, and we are just wondering if those have been resolved for all of the colleagues. This is just before we go into the panel, a quick reminder that translation is available for English, Russian, Serbian, and Bulgarian, and that you can choose the channel for interpretation at the bottom horizontal menu that has the globe under which it says interpretation. And I hope that it works for the majority of participants. If it is only individual, it might relate to the need to update Zoom platform or something similar. But I haven't noticed more recent complaints in the chat, so I take that everyone can understand. I also use opportunity to remind all that we are recording the webinar in all the languages in which it is provided today. So the links to these recordings will be sent together with the materials, presentations, and other resources that we will share today. So with this, I would like to share that we have 4 very esteemed professionals today with us from Serbia and Bulgaria, who are supporting nurturing care in practice as managers, practitioners, or trainers. And we are very eager to hear from them what are their perceptions and experiences on how the practice guide can be implemented on the ground. And I think that they will be the best to start responding to Sheila's question on, what could be the next steps and how can practice guide start to live in this form in this region. I hand the coordination of the panel to my colleague, Vera Rangelova, ECD specialist at UNICEF ECHA office. Over to you, Vera, and I kindly ask our panelists to put their cameras on.
Thank you so much, Alex. In the next part of our webinar, we will have a panel discussion on how the practice guide can be implemented in practice in our region, with a more stronger focus on primary healthcare services. As Alex mentioned, we have 4 distinguished guests who will be speaking and who share with us their thoughts, reflections, and experience related to implementation of the recommendations and ideas into which you can find in the practice guide. I have the pleasure to introduce our speakers, Dr. Daniela Nesic, who is a Deputy Director of the Primary Healthcare in the city of Niš, Serbia. We also have with us Ms. Snežana Milutinovic, who is a head of the home visiting service in the city of Bor in Serbia. And Ms. Jasmina Birta, who is practicing home visiting, and she is interacting on an everyday basis with families and children. And last but not least, we also have with us Dr. Ruža Pančeva, who is a professor at the Medical University in Barda in Bulgaria at the Department of Hygiene and Epidemiology. I welcome to all of our distinguished guests, and I would like to start with Dr. Nesic and Ms. Snežana Milutinovic, because you are involved and on an everyday basis in administration and management of health services. And from your perspective, how this guide can help you create an enabling environment for practitioners, but also for families to strengthen their support for nurturing care. We will be very interested, as Alex mentioned, in Serbia and our region, and in Serbia, it's been a lot of focus on integrating support for nurturing care in the primary healthcare system. So it will be very interesting for your and to share your experience, but also inspirations and ideas for the future, how the practice guide can be applied. And just a little bit at the end, we'll be very happy. If you could a little bit touch how the practice guide and the recommendations can help strengthen the cooperation between the practitioners within the healthcare system, like gynecologists, pediatricians, developmental specialists, but also outside the system with other services providing support to families. So Dr. Nesic, if you would like to start, the floor is yours.
Good morning, everyone. It's a great pleasure to be involved in today's webinar. Our healthcare institution is very large, the largest in Serbia. 1,500 staff are employed. We have very well developed developmental counseling unit and motivated home visiting nurses who do implement everything that they have learned and heard in all your webinars, and they're fully involved in this. Since I received the guide and read the guide, I have organized the provision of information to all the services, meetings of head nurses, or meetings of heads of different units, and I'm very happy that their response was very good. They are very interested. Pediatric service has excellent communication and cooperation with home visiting service. Practitioners in the developmental counseling unit will be able to use a lot from this guide, and I will do my best to ensure that we have excellent interaction between all these services so that this guide can be of great service to us and help to us. The role of the manager is very important, providing support to healthcare workers and associates, and in all respects. And you said a moment ago from ensuring that toilets are adjusted to the needs of children, ensuring proper climate and enabling environment in our institution. And I'm sure that our institution will have excellent benefits from this guide, and I will ensure that this is adjusted to all the services and presenting to everyone why this is important. Miss Rangelova, we cannot hear you.
Yes.
Miss Rangelova, unmute yourself, please.
Vera, we cannot still hear you. Could you try unmuting? Try now.
Yes, now. Can you hear me now?
Yes,
Can
we
you
can.
hear? Yeah. Thank you very much, Dr. Nesic. I would like now to invite Snezhana Milutinovic, who is head of home visiting service in the city of Bor, and who is managing and also organizing the work of the home visitors from her perspective, how to share a little bit about her experience and also about ideas for taking forward the recommendations from the Nurturing Care Practice Guide.
Dobar dan svima.
Good morning, everyone. We have been working on playful parenting program for a while, owing to the support to the city of Bor. It's one of the first 6 cities for the implementation of this program. The Nurturing Care Practice Guide can strengthen the existing capacities of managers and practitioners and give us clear guidelines in adjusting healthcare services and integrating all the components of nurturing care. If responsive parenting and care is directed towards the needs of the child and all 5 components that we listed and heard from the guide, the key thing is for us as practitioners to implement actually in our work through home visits, and to connect the healthcare service of women, so antenatal care and healthcare service provided to children. So there is a need for support by managers of primary healthcare centers, and there is need for assistance by local communities. So home visits get a new dimension. We deal not only with health needs of the families, but we also, if we remember, I participated in caring for the caregivers program, and so we focus at the mental status of parents, their relationship as partners. So home visiting nurses get a new dimension. They focus on the partners' relationship and interaction between parents and children. The focus is on home visiting nurses, and we can use this guide in the best possible way in order to horizontally connect all services in the healthcare sector, dealing with children and parents, and we connect and ensure multi-sectoral cooperation. The program requires that as well, and the guide can be used for that, to ensure that the healthcare sector is connected with preschool education, is connected with social care as well. What I noticed working in the nurturing care is to ensure that both partners are involved equally, putting focus on fathers to get involved in the antenatal period and later in all daily routines concerning parenting and providing care and all the needs of the child. The basic goal that I believe the program has is to ensure proper care for the child.
Thank you a lot. Thank you a lot. It seems that already many of the ideas from the practice guide are implemented in practice. And I would like to ask Ms. Yasmina Berta about her experience, because she's also a practicing home visitor and is interacting with children, with families and children on an everyday basis. If she can share a little bit about how the recommendations, the ideas from the practice guide are already integrated in her practice. And also a little bit about how the guide and the ideas can help the practitioners to provide more comprehensive support to families going beyond health, but including also support for parenting, nutrition, and early learning. And just a little bit about at the end, I would like to ask to touch the issue of competencies, because implementing and strengthening support for nurturing care requires really support specific competencies on the part of the healthcare practitioners. So if you can a little bit share about, from your perspective, what are those key competencies that practitioners need to be to have in order to effectively engage with families. Ms. Birta, it's the floor is yours.
Dobar dan svima.
Good morning to everyone. I would like to tell you first that the guide provides us the guidelines how to integrate all the components and supports us to improve the quality of services within our regular contacts with the families as home visiting nurses. What I would like to tell you is that before, home visiting nurses were more focused on introducing adequate nutrition, the importance of immunization. But since we have been focusing on nurturing care and parenting, it was a great challenge for us. The support that we were required to support to parents in providing playful parenting and nurturing care was a great challenge. And this all inspired us to think, what skills do we need to have, what competencies we need to have to be able to empower parents, to support them so that they could provide quality care to children and to create an enabling environment for a child. So that made us think a lot. We had great trainings. We have been strengthened in this. And for example, one example from one of the visits recently to a family that has 2 kids. One child is 7, and now they have a baby 5 months old. And parents told me, you now somehow talk to us differently. You work with us differently. We were so worried how we are going to be with this second child. It was a great challenge for us, but now we are going through this parenthood much more easily with your support. So our principle of work, our contact with parents is a bit different today, I can say. We are trying to empower parents so that they can communicate with their children. Before, we used to, for example, when we were supposed to introduce the solid food, we were talking more from the technical side. But now, in addition to that, we also talk about how, in which way they recognize the cues of the child when the child is hungry, to encourage the child, to support the child, to explore textures, for example, tastes. For us, this all has been very significant, and it's also very significant for us to get feedback from parents that is positive. This all affects the quality of our work, and both parents and we have the same goal, and that is to encourage every child, to provide every child a new start, good opportunities for developing their full potentials. As for your questions, the competencies and skills that the practitioners need to have. First of all, listening skills, communication skills, empathy, for example. Nothing can be done without empathy. The skills of observing, interpersonal skills, and responding to the needs of parents, responding to the needs of children.
Thank you a lot. Thank you a lot. This was really inspiring with very concrete examples how the practice can be implemented in practice. And I think the skills you also mentioned are really important, and it provides a very good transition also to the next speaker, Dr. Pancheva from Bulgaria, who is involved in training of future and current health practitioners. So Dr. Pancheva, could you share a little bit from your experience? I mean, expand on the issue of competencies and skills that health practitioners need to have to effectively support families for nurturing care. And also how you address these competencies in your work and in the training programs that you are involved in delivering. And maybe the last thing is, in general, how the professional developments of practitioners, health practitioners, needs to be strengthened and enhanced to ensure really stronger support for caregivers for nurturing care.
Thank you, really, and thank you for having me for this really fantastic meeting. My participation is also a type of commitment to go on working in this area. For me, the guidelines recommend a holistic and collaborative approach to working with children and parents, and this involves really additional skills. And thanks to my colleagues that they touched on this already. And I would like just to include a little bit more on that. So the communication skills are number one, also on my list of important skills. The active listening, empathy, and clear and also very concise communication and understandable speaking is really important. Then I think that cultural competences are very important. We as the professionals and also teachers should be aware of cultural differences and how they impact child rearing practices and parenting styles, and they need to be able to adapt approaches to accommodate diverse cultural backgrounds. We also need the additional skills and to build on this and on the knowledge of child development, which and our students and our colleagues that work in this area should have a sound understanding of child development, monitoring, screening, how to identify developmental delays or problems. And this helps in providing appropriate interventions and support later on. Of course, the interdisciplinary collaboration on which the guide focuses and involving not only healthcare providers, but also educators and specialists from different areas, society, public health specialists. The guidelines recommend a collaborative approach involving multiple disciplines. And practitioners and we as teachers should be aware to work effectively in a team between us and between the family and to prioritize the family's needs. And additional thing which I think also important and the COVID period and pandemic, what its importance, this is the digital skills. They're also important in the context of nurturing care because technology has become an integral part of modern healthcare delivery. Digital skills enable us as teachers and our colleagues and the members of the nurturing team to access and use digital tools, platforms to enhance their practice, to get in touch with the patients and families that might be at a large distance. To improve communication, collaboration, provide better care to children's families. and they help us access to new information, communication and collaboration, and data management. This also helps with the patient education, and overall the digital skills are important in the context of the whole program of nurturing care. For me, in fact, this guide is really very practical and very helpful. And if I think for the previous tools as a way what to implement, what are the expected changes in our practices, this guide is how to do that with a prioritization for each of the five fields, which are the main points we have to think of. And the metaphor and also a tool of a checklist is something that I think as a trainer would I use in my training and practice later on. In fact, the document does not provide specific information on whether pre-service or in-service training programs adequately address these recommendations, but it focuses also on that there are gaps in training, and we need to cover these gaps and to improve our training. And based on the guidelines and my personal experience, I also recognize these real gaps in the current training programs for medical professionals, both in the area that I work, but also in other medical programs. And that is why this guide is really a step ahead. It's another tool that would help us. It is also a very good roadmap regarding the pre-service training is helping us improve our training. Let's just focus a little bit on some of the achievements that we have in my area, and the achievements that are a good base of improving things further, having in mind the guide. For example, our future doctors, nurses, midwives, health managers, but also speech therapists and kinesiotherapists have both mandatory topics and elective disciplines in their curriculum dedicated to nurturing care. And they carry on these disciplines and topics with the help of supervisors. For example, nutrition of children with special needs, breastfeeding support for children born at risk, monitoring and screening of child development, control of pollution, and ensuring optimal microclimate in family environment are topics that have been already incorporated, but further will be developed with the help of the nurturing care guide. We have also disciplines for public health inspectors that involve child development assessment, disciplines where topics such as early intervention, child nutrition, safe family environment, microclimate, and disease prevention are included. Our university works also in close collaboration with NGOs, which are well established, and primary care facilities established for their and a good example, benchmark for early childhood development support, where some of our students have their practicals or placements. And this is a good base for improvement, as I said, applying also the guidelines. Staff from these NGOs and primary care facilities, such as speech therapists, rehabilitation specialists, psychologists, ergotherapists, early childhood intervention specialists, also lecture for our students and apply also case-based teaching. Also for the in-service training, we have included some continuing education courses and workshops that will be improved also with further with the nurturing care guide. And these courses in our university provide additional points which are collected by professionals that are needed to show their lifelong learning commitments. For example, we have CME courses like breastfeeding support, nutrition in the first 1,000 days, early childhood intervention support, recognition of early signs of autism that have been developed with the help, participation, and collaboration with the NGOs and also that work in family-centered programs, and some of the UNICEF representatives have been developed lectures or presenters for our CME courses. And we are planning to improve them just following these last updated steps. An additional thing for which we think and we commit, these are some scientific research group activities that are in collaboration and also within our university. Our students, our young investigators are involved in our university research groups and are working on topics related to child development, delays, nutrition, support. And a couple of dissertations have been defended in this area, and these results are also presented and incorporated in the teaching curriculum of our students. So if I have to just touch a little bit on the professional development that could be enhanced to support the implementation of the recommendation to the guidelines, I would focus on the incorporation of the guidelines into the curriculum, to which obviously all of us have some good base. The guideline will help us improve further our teaching. An additional thing which we see is very helpful is the use of case-based teaching, especially when case-based teaching can be used to teach students how to apply the guidelines in practice in collaboration with benchmarking centers. And additional enhancement could be done with the provision of interdisciplinary training, incorporation of cultural competence training, and the provision of hands-on training. So really benchmarking and good leadership from the side of such organization as UNICEF, Step by Step, and WHO is really necessary, especially if all these achievements are also incorporated in our teaching and training programs.
Thank you a lot, Dr. Pancheva. It was really very important I mean, you managed to outline the key issues and takeaways for all those involved in professional development of health practitioners. And really the guide can serve also as a framework and guidance for them when they develop their programs for health practitioners working with families with young children. We are approaching the end of our discussion, but I just wanted to ask if Dr. Nisic or Snezhana Miutinovic and Yasmina Birta would like to add something, some last reflection in terms of the guide and the takeaways, what could be implemented in the future. They can speak if they would like to add something.
Evo, mogu ja da kažem.
Okay, may I
Thank you.
take the floor?
Onako, želim da kažem da
I
vodič...
would like to say that the guide does offer us a number of options and ideas that we will truly be able to implement in our activities in families. We need empowered parents, and we also need to be empowered with all the capabilities, and this will lead to higher quality of our work. And as I said a moment ago, all in this is in the interest of the child, the best interest of the child. That's it from my side. Thank you.
Thank you a lot. Thank you a lot for all wonderful interventions and contribution to the discussion. And now I would like to hand over the floor to my colleague, Alex.
Thanks a lot.
Sorry, Daniela wanted to add something. Sorry for jumping in. Yes,
please.
Yes, sorry.
Please go ahead.
I just wanted to thank you for this wonderful guide that you have prepared for us, and this will help greatly to connect gynecologists, the developmental counseling unit, pediatric service, home visiting nurses, and I will make sure that all the managers and heads of departments in our healthcare center will be informed of all this, they haven't had an opportunity to actively participate in an event like this. Thank you.
Thank you a lot. We thank you a lot for your participation in the discussions and wonderful insight into the implementation of the practice guide.
It's an honor for me too.
Thank you. Thank you all, 4 of you. We have been really privileged that you could join us today. And this is to really give only a small illustration of what is the great work that is already happening in your daily practices, not only in the 2 countries that we heard from today, but I know that many our colleagues have joined from the whole region. So this is to congratulate you on the great work that you have been already doing, because I think that the publishing of the practice guides stands as another proof that you're on a good way and is there to further support you as a job aid that you can keep very handy. And as colleagues have said, not maybe to provide every advice at every occasion, but as you are using it, as Yasmina reflected, you will be experts in knowing which opportunity to use to send which message to empower the parent to be the confident and secure in its parenting role. Thanks a lot. We have a few minutes to address questions, and Sheila was very kind to respond to a lot of questions in the Q&A that referred to adaptation, translation of the guide. So as we are looking if there are more questions, and still encourage you to put the questions in your languages. You don't have to put it in English in the chat or in Q&A. I will ask Sheila if she wants, or Anne, if they want to comment on some of the questions that were mainly related to the global theme in terms of adaptation. And I will, and I can jump in terms of the regionalization and support to translation.
Thanks, Alex. I think, as you rightly said, it's so exciting to see what is already happening, at least in Serbia and Bulgaria that we heard today, but also how many other ideas have come just from the discussion today. And Annie and I were chatting on the side and saying, oh, we need to write all of these down and then have these summers. So it would be really nice, maybe if we can think about documenting and pulling these out and having a list, right? A starting list of things that people could try and do. I loved hearing the word empathy or empathetic. That was so heartwarming to hear, because I think, Jasmina, as you rightly said, the families notice, right, that we are treating them differently, and that changes the nature of our interaction. It changes the issues that they might bring up that they might not have brought up before. It opens the door for you to share ideas and information in a way that they will be receptive to it. So many times I've seen people that share ideas, give recommendations of things to do, but it's like it goes in one ear, it goes out the other ear, because the parent is not engaged in that interaction in any way and is not really seeing this as a person that is someone who can guide me on my journey here. So indeed, those soft skills, which we talk about in the guide, and which Jasmina and Dr. Panjeva, you mentioned also, are so crucial and really are at the heart of this. When you spoke, Dr. Panjeva, about the practica and the cases, I was like, oh, that's a really good idea, right? It's a good way to kind of test out these ideas with the students and get them to put it into practice right away. So really, thank you so much. There was a question that came in the chat that I just wanted to address here, which had to do with the applicability of the guide to other sectors. Because, of course, here we're talking about the health sector today. That's been our primary focus. But I think even during the panel, we heard some reference to other sectors and other providers, even within the health sector. As we explained, the guide was developed very much in response to this gap that we were seeing. We kept saying that these health and nutrition services are an opportunity. And so we wanted to respond with something concrete that says, okay, if this is an opportunity, how can we use it better? Having said that, there's a lot in the guide that could lend itself for adaptation in other sectors. So, for example, the first section, which is really the rationale for why we need to be thinking about these other components of nurturing care more systematically and caregiver well-being, that content you could lift and use in dialogue with other practitioners in other sectors. And then, as you've seen, the tables give a lot of practical suggestions, and though they're organized by service, you might look at them and say, well, these are suggestions that I could provide to an early childhood educator or a social worker. And so you might say, I want to adapt these tables and think about a different set of guidance that I could give, or even the same ones, but package it differently for a different provider. So absolutely, I think there's room to contextualize the guide for the health sector in different contexts, but also adapt it for use with other sectors. I'll stop there. Annie, I don't know if you wanted to come in.
I think you said it all, Sheila. It was just really nice to hear all the things that are happening. And indeed, I think this is the kind of learnings that we would like to collate and make available more broadly. So we will find a way to either extract what you said and put it on the website as videos, or write it up, and please, share any experiences once you start sharing the guide. It's also really nice to hear that you really find it useful. Any constructive feedback to us is very welcome, but I hope that we indeed provided something that you can apply in your context.
I think that you can see that interest is great. And I hope that the guide will be even more accessible when it becomes available in local languages. And I think that I can speak on behalf of our colleagues from WHO Euro, and iGood is online as well, and UNICEF, that you can direct your requests to us. If you would like the practice guide to be translated to your languages, the procedure has been much simplified now. And we would really encourage seeing the guide and the guidance from the guide, because all of those tables will only remain the pieces of text if they are not translated in everything that we said in the training, in the daily practices, because people like simple solutions. And I think that the guide was really, well developed to give that simple solution that you can put in practice today, not even waiting for tomorrow. So we will be waiting your requests. Of course, we will prioritize languages that can benefit multiple countries, but guide is also modular, as you could see. So you can also start with first module, or start with something that makes the most sense, or start with something that you can include in the training provision tomorrow, and then continue. We will also see how the health systems for ECD platform can support these efforts, and in publishing all the resources that can be handy, but the link also to Nurturing Care Practice Guide is shared. And if we don't have further questions, and I don't see in the chat, we promise that we will share a few more resources. Because really, if anything, resources have been developed in the meantime, and these slides will also be shared. Everything from this webinar will be shared, multiple recordings in multiple languages, and all the materials, so you will be able to find all the links. And Sheila will help with walking us quickly through the global resources first.
Sure, Alex. So we'll go quite quickly, because all of this will be provided to you after the webinar in the resources with the recording. But we just, at the beginning, I mentioned that there's been a number of resources that have been developed. I think we're over 30 resources now that we've developed to support implementation of the Nurturing Care Framework. Today, we only talked about one, and we reminded you of a couple others. So we encourage you to keep looking at the website, exploring different things. The thematic briefs we find have been extremely useful in many contexts. They take a particular issue or a population and look more deeply at what we could be thinking about when we say nurturing care for every newborn, or nurturing care for children living in humanitarian settings. And because they've been so successful, we're working on two more. One is on responsive feeding, so nurturing young children through responsive feeding, and another one is for children with developmental delays and disabilities. And also wanted to let you know that this May marks the 5-year anniversary since the launch of the Nurturing Care Framework. So WHO and UNICEF were working together on a progress report. And this is intended to look at those 5 strategic actions and say, okay, what has happened? What are some stories of change or success in each of those strategic actions? And what could we be thinking about going forward on the next chapter of the implementation of the framework? Next slide. These are resources that you will get in the email after the webinar, but we just wanted to make sure you are aware of these other resources that are not under the Nurturing Care brand, but have implications and can support us with the work that we do. So there's a practice guide around home-based records. There are new guidelines around parenting. There are new resources when it comes to measurement for children 0 to 3 years of age at population level and programmatic level. And then some of you have already worked with the Caring for the Caregiver package in the pilot phase, but the full package is almost ready for release as well. Next slide. As you heard, we did an official launch of the handbook and the practice guide last week. So if you want to go back to that, the recording is available on the website, and you can get a bit more information about the handbook and then maybe see some of the questions that came up there and ideas for the practice guide and handbook also. The practical guide that I mentioned for strengthening implementation of home-based records, there will be a webinar around that on the 20th of April, sorry. So you may want to keep an eye out for that. And then the progress report that I mentioned, we will have an official launch for that progress report towards the end of May. So we'll make sure that you are aware of that and can save the date for that. Over to you, Alex.
Thanks a lot, Sheila, and we will make sure to also communicate all of these important dates through our newsletters and to also republish all of the materials also at the regional learning hub and the platform so that you can find them easily. This is just a quick reminder that building of the resources also in ECA region started even before the Nurturing Care Framework has been formally launched, but it covers a lot of the thematic areas. This is a rich training package of 22 modules that have been used to train home visitors. Initially, that was the idea, but later on, a lot of the primary healthcare doctors, family physicians, social welfare practitioners, and all of those who support nurturing care of young children. The modules have been also digitalized, speaking back to what Ruja is saying, that the digital space is becoming more and more relevant. So you can find them also on the Learn ECD platform, and they are freely accessible to everyone from the whole world. The platform is being now customized in many different languages following the demand of countries. So we hope that it will serve the purpose of providing at least an additional continuous professional development opportunity. Again, speaking of digital, I think in the last moment we recall that we also have a digital tool that complements the efforts of the health and other professionals, and that is Bebo Parenting app that is available now in 14 countries of Europe and Central Asia region, and it also provides nurturing care advice and guidance for the parents and caretakers of young children 0 to 6. We have provided links so you can download and try. It is being introduced also by the health professionals in these countries. And finally, we have last week, in the last webinar, we presented the pocketbook, WHO pocketbook of primary healthcare for children and adolescents as a very important reference point, and again, a resource guide on how can different messages and focus be implemented with all the visits that are and encounters that are happening between the child and the health system. And another very valuable tool developed by ISA that helps in the assessment of the workforce needs when the home visiting is in case. All of the resources are already on the platform and you can visit them. And I think that this is the last slide with resources. We are reminding you to subscribe to the mailing list so that you can be invited and reminded of all the events and get all the resources, but we are not at the end. We have two very distinguished speakers who are with us today, and representing regional offices of WHO and UNICEF is Dr. Aigul Kutumoratova, who is the Technical Officer of Primary Healthcare and Child and Adolescent Health and Development at the WHO Regional Office for Europe. And we have Evelina Borisova, that is the UNICEF Regional Advisor for Early Childhood Development. And I kindly invite them to come and to share their closing remarks. And at the end, for those who have the most patience and rigor, we have a surprise video. So I hope that you will stay all the way to the end and invite Aigul, Dr. Kutumoratova, to join us and share the remarks.
Thank you very much, Alex. Warm greetings to all the participants of the webinar, panelists, presenters, and the organizers of these webinars who made this event happen. I would like also to congratulate with the launch of the nursing care practice guide to managers and health professionals from Europe and Central Asia. And special thanks go to UNICEF and WHO headquarters team, in particular Anne and Shayla, and the panelists for the excellent webinar, interesting, informative. And I would like to thank the whole team of ISA and UNICEF, because they do a great job to support the knowledge platform operational and accessible for many professionals working with young children and their families. And I want to bring just a couple of messages. First of all, as you see from your questions, wonderful questions, and also presenters and panelists, ideas from presenters and panelists, a strong part of the nursing care practice guide that it addressed right questions to be asked and right actions for the both key side of service provision, managerial side and clinical side, which is not always the case. And it gives a clear guidance on what managers can do to facilitate implementation of nursing care in daily practice of primary healthcare providers. For example, by reinforcing already introduced elements of nursing care or by supporting trained staff. And what health and nursing staff can, nutrition staff can do to deliver comprehensive, responsive, and family-centered care. Therefore, in my opinion, this guide helps to focus on the most essential implementation activities. And second, these and other support tools and resources that have been shared today with you can be instrumental to inform a revision of pre-service trainings program for doctors and nurses in its part that relate, for example, to infant and young child feeding practices, healthy growth and development, effective counseling of families with young children, and promotion of responsive care by parents. And again, thanks for your questions you raised, because it gave us a good ideas on how the practice guide can be used in the region. Thank you for raising questions about translation in different languages, because it's definitely the right way to get to the right audience that needs this document. And to conclude, I would like also to encourage you to read this practice guide, to better understand how and what can be done from what can be taken from it to improve current services in your context. And of course, to disseminate this guide and the other useful resources from the knowledge platform among your colleagues, your teams, and professional networks. And at the end, I would like also, for those who are celebrating Easter, I would like and wish a happy and peaceful Easter. And for those who are immersed in Ramadan, I also wish very peaceful reflections. So thank you.
Thank you, Aigul, so much for the wonderful words. It's a pleasure when we work all together. It makes the difference when we work together, and we all committed to do so, continue doing so. And with that, I invite Evelina Borisova for her final remarks.
Thank you so much. And it's such a pleasure to be with everyone. And thanks for the patience, for staying with us until the end. Like Aigul and everyone, first, I'd like to say many thanks to our amazing panelists and presenters. It's always such an inspiration to hear you, and gives us a lot of motivation to keep doing what we do. I also want to say big thanks to the colleagues from WHO and UNICEF in headquarters for familiarizing us with the Nurturing Care Guide and Practice Guide today, and allowing our region to really quickly pick up on this new guidance following the global launch. We're a very eager region, as you see, and very glad that these resources became available to support quality programming for young children. I wanted to maybe build on the points shared by the panelists. As many of you know, UNICEF's programming in support of the early years through the health systems has a very long history in Europe and Central Asia, over 15 years actually. So we're very lucky to be in this very important moment in time. For us, the launch of the Nurturing Care Framework in 2018 was a very important milestone, I think, really validating and reinforcing the amazing work that was already taking place in this region. And I think the practice guides and the handbook are really coming at a very critical point as well. Those of you familiar with our region, and I think that's many of us here online, know that the health systems have been recognized as particularly important entry point for the well-being and the nurturing care of young children. Of course, because of its universal coverage in this region, but also because of the trusting relationships that already have been established between health professionals and parents. The work of this kind of system level work has been carried tremendously by the home visiting programs that have been strengthened, reformed, and continue to grow now in more than 17 countries, and more is happening in this area. And many of you know already from previous webinars and discussions that this amazing home visiting set of platforms and resources are anchored in a lot of recommendations and training resources that fully integrate the messages of the nurturing care framework. So I think we're very lucky to already be on a very positive track with this work, and the publishing of the Nurturing Care Handbook and Practice Guide comes at a very opportune moment indeed, when we recognize and help us reassure us all, including the policymakers and practitioners who are on the front lines of this work, that our efforts and your efforts are very well aligned with the global guidance that's coming forward. So thank you for the authors and the colleagues behind this. I think you're the wind behind our wings, as we say, and it really is welcome and appreciated. I just want to say a few words about the guide. As Aigul mentioned, we particularly see it as very practical and easy to use, and really builds on experiences of countries and practitioners, which is really important because it gives it that much more legitimacy and validity for how useful it can be in the right set of hands. I think from our perspective, we also see that it focuses exactly on kind of the paradigm shifts that are most needed in the health system still and its professionals, in terms of supporting the responsive caregiving side, but also the safety, security, early learning, and what we have seen as crucial is the caregivers' well-being and mental health, which is really crucial for the well-being of children as well. From the regional side, we're really happy to also see that the practice guide really complements resources that have already been developed regionally with the partners that you see with us today, very closely working with the International Step-by-Step Association, WHO, associations for pediatricians. So this is wonderful to see now this new sets of resources complementing what we have and putting it in a very user-friendly kind of job aids that can really provide inspirations and ideas for how to care for children and their parents better. I wanted to also mention perhaps the wider challenge that is still in front of us in terms of thinking through all these amazing resources that we have with us, of our training professionals, practitioners, putting job aids in their hands. All of that really still very much is anchored in what health systems need to be able to provide to institutionalize the practice that we want to see. And regionally, we recognize that there's still a number of structural barriers that need to be addressed in countries across the region to ensure that this amazing practice that we are hearing from today in support of early childhood development is really sustainable and institutionalized in the system. Here, I wanted to particularly focus our attention on the necessity to recognize ECD in the relevant service standards and the basic health packages and payment and financing formulas. These are the hard parts that I think many of you are working on already, and we'd love to support you more in this. I think the guidance, the practice guide, together with the handbook and the recommendations from WHO Pocket Guide for Primary Healthcare, really provide very useful references as to what elements exactly need to be recognized in health policies and legislations and standards in order to ensure what we have heard is crucial: time and resources to support nurturing care, because it comes down to that in the reality of day-to-day practice of health professionals. So we really hope that by promoting the practice guide, health managers will keep in mind this bigger tasks ahead of us as well, and really helping to advocate with decision makers about some of the system level changes that are also needed, continue to be needed, to ensure sustainable service delivery of nurturing care and early childhood development through health systems. I wanted to end what probably is very clear from this webinar, that UNICEF in this region remains deeply committed to continue supporting these efforts and to ensure that every child and its caregivers receive the support for nurturing care as a part of routine healthcare services. And we're deeply glad that in this mission, we have joined forces with WHO, with International Step by Step Association, and with so many amazing technical experts through the Health Systems for ECD initiative, and that there's more and more discussions like this one with policymakers, with managers, with health professionals, and many others to help us pave the way towards this joint vision and showing that change is possible, as you have today, with great benefits to societies. And thank you very much for joining us today, and we look forward to the continued dialogue, discussion, learning, and everything that's to come. Thanks a lot.
Thanks a lot, Evelina. Thanks a lot, Aygul. And thanks a lot to Sheila and Anne and the whole global team that have found the time to help us to present in this webinar and to make it possible. Thank you to all the loyal participants and who have stayed with us all the way until the end. And we really have this beautiful video that was developed by Serbia Country Office on what they call orbits of support to parents, because every parent needs some support, some needs more. But this animated video shows beautifully what are the orbits of support and what is that each professional in the system can give to a caring parent. So we wish you wonderful holidays, and we will follow our mailing list, our newsletters, to get more information on what are the next events, and enjoy the video.
Pa čestitamo, postali ste roditelj. Možda vam za to ne treba poseban fakultet, ali u pitanju je najveće zanimanje na planeti. Nije lako brinuti o zdravlju, ishrani, bezbednosti deteta, biti topao, dostupan za dete i spreman za igru. Zato svi treba da budemo tu uz vas, jer u prvih 1000 dana razvoj deteta je najbrži i najuzbudljiviji. Stvara se veza i bliskost deteta i roditelja. Dete vam šalje znake, ali glavni tumač potreba ste vi. Kroz igru se uči, razvija i raste. Gradi se roditeljski tim, čak i kada ne živite zajedno. Stres je najveći, ali se uz podršku drugih i brigu o sebi može prevazići. Zvuči nemoguće, ali uspećete, korak po korak. Trudnoća je niski start, priprema za veliku ulogu. Već u ovoj etapi imate 2 saveznika, ginekologa i patronažnu sestru. Sa njima razgovarajte o svemu što vam treba da budete spremni za dolazak bebe. I ne zaboravite da radite stvari koje vam prijaju. Svaka mala stvar koju činite za sebe, činite i za dete. Razgovarajte sa bebom dok je još u stomaku. Puštajte joj muziku. Bebi znači da čuje vaš glas. Razgovarajte sa partnerom ili partnerkom o svemu što vas raduje i što vas brine. A ako se ne složite oko imena za bebu, naučit ćete i kako da se pomirite. Vreme da se vi i vaša beba izvanično upoznate. Dajte sebi i bebi vremena da se osetite, upoznate, povežete, da se oporavite od porođaja i pripremite za povratak kući. Posle porođaja, verovatno ćete se osjećati iscrpljeno. Ponekad će vas preplaviti snažna osjećanja. Slobodno o tome razgovarajte sa osobljem iz porodilišta. Neka oni budu vaš krug sigurnosti, kao što ste vi za vašu bebu. U porodilištu se ne rađaju samo bebe, već i roditelji. Počela je nova etapa života sa puno ushićenja, malo spavanja, koje zahteva puno strpljenja. Setite se da vam je na raspolaganju i patronažna sestra. Sada sa bebom prolazite kroz novo osjećanja. Gradite svoj porodični krug sigurnosti. Kroz dojenje, kupanje, maženje, čitanje, igru, beba uči o svetu oko sebe, a vi o roditeljstvu. Uz malu pomoć izabranog pedijatra. Mnogo ćete naučiti kroz zajedničke odlaske u nabavku, spremanje hrane, kroz sve ono što porodicu čini porodicom. A onda dođe vreme da pustite dete u svet. Za početak, sat, 2 dnevno. Polazak u vrtić je još jedna promjena za vas i vaše dete. U vrtiću dete stiče brojna nova iskustva i rado će svoje doživljaje deliti sa vama, najčešće kroz igru. Ovo će vam pomoći da bolje razumete šta vaše dete interesuje i da kroz igru podstičete njegovu znatiželju. Ako beba požuri na svet, imat ćete podršku neonatologa. Ako razvoj bebe ne teče očekivano, tu su razvojna savjetovališta. Sigurna kuća može biti vaša dodatna zona sigurnosti, ako vam je to potrebno. Roditelj koji ima podršku onda kada je najpotrebnija, može da pruži svom detetu najbolje od sebe. A kada dete raste uz toplog i podsticajnog roditelja, ono može da ostvari sve svoje potencijale. Rana iskustva traju ceo život.